Hey guys, Don here. I want to talk to you a little bit today about there's this book that came out, and I'll put a little link to it. It's called The $15 Trillion Free Zone. We get these quarterly books. That's something I go to called Strategic Coach, and I like the topics. And in chapter 1, it talks about shortcuts. And basically what these are intellectual shortcuts that we develop in our own practice. And I think we all do them. And for the most part, we just keep them to ourselves. But this is the real value that we provide in our practice, for our patients, for everything that we do. And it's really a lot of these shortcuts that I'm trying to share here on Podiatry Practice Mastery. And what are these shortcuts? Basically, the whole struggle is we have struggles that we go through in our practice, things that are challenging. I talked recently about, there was a doc I was talking to, and he was saying, I can't do a capital outlay for a shockwave device, but I want to increase profits. So what are some of the shortcuts that work for that? And I just want to go through a couple of these that have been helpful in the past for me, and if they might help you, that'll be good. If you want to learn more about them, please send me a message. At the bottom of this, there's going to be a way you can send an audio message. Basically, what you do is you just have to log in, put your name, like an email, and a password, and then you can send an audio message, and I'll try to answer those periodically if it's a good question. Okay, so the first intellectual shortcut that I like to talk a lot about is something called patient presentations. And basically, this happened to me because I was struggling with the complexity of treating a lot of conditions. And basically, whether it be plantar fasciitis or pre-op discussion, I had a lot of things I wanted to share, and there was really no great way of doing it. And sometimes it got overwhelming because there were so many things we wanted to share. And this presentation was basically a PowerPoint that I put together, and I started to go over it. And I did it initially on the pre-surgical discussion. So I went over all, like, what's the surgery we're going to do? I explained it, what are the possible complications? And it was much more thorough, and I didn't really rush through it. Because what I found is if I had 2 minutes, I went through the 2-minute pre-surgical discussion. And if I had 20 minutes, I would take more time with it. But it was never really a structured method. And then it kind of evolved into dealing with like plantar fasciitis. I have this kind of presentation that I do, and I go over kind of what causes it, how we can treat it, and then in their specific case, what we're going to go through. And specifically, there's a checklist that I find invaluable. And basically, this checklist goes through all the different treatment options. And then when they've come back in like the 10th time and they're not better, I'll go through that checklist and say what we've tried and what we haven't tried. So that's kind of a shortcut that's worked for me. Once again, if you guys have other shortcuts that have worked for you, please let me know. I'd love to hear about them. Webinars has been a great way of making content in our office, and that was one of our last group sessions. And if you want to get that, you can just go to Podiatry Practice Mastery and get access to all the old ones. But the webinar is basically what it is. It's every other month we do a webinar on a certain topic. Basically, we take the big areas on our website, whatever we have these, big, what we advertise. It could be ingrown toenails, it could be flat feet, it could be plantar fasciitis, Achilles tendonitis, and we do a little webinar. So the same thing, you take these presentations and you make your own. We divide it up amongst the doctors and we do a webinar. And usually we get about 70 people that register, and then maybe 10 or 20 will show up. But then afterwards, we send it out to the same group and they'll watch it. And then we also send it out in a newsletter that we'll do to them. So that's another way. And then they'll look at that. And that's something that's been kind of a shortcut for us. Another shortcut that's worked well is doing an actual video newsletter. And we've only been doing that for a couple of months, but I found it much easier than writing a newsletter. Everyone's told you should do newsletters. I just found it was really hard to write. For me, not writing that's hard. It's just we want to be perfect. Right? And that's not good enough, or I want to talk about that. I found what's really good is you just take a few topics, you record a little bit of a webinar, like 3 minutes, you send it out to the patients with a few links if they want to follow it. So if you want to go to my YouTube, you can see those at drpelto.com. You can see not the webinars, I'm sorry, the newsletters that we have for our office, if you want to copy that. Another intellectual shortcut that's worked really well for us is something called Patient Education Genius. And basically what this is a program that you pay for. I think it's like $100 a month. It integrates with your EMR, and it sends out, I upload all my patient education information in there. And it's cool because it gives them the patient education information. I'm printing less things, but more importantly, it's getting an online review. Every time they go to Patient Education Genius, that thing that I send them, it has a chat bot. And that was a question actually recently from someone about chatbots. This is a chatbot within the education framework. and then they can give a good review for us. That's how we get so many reviews online. So that's called Patient Education Genius. I'll put a link to all these underneath. Another thing would be using videos to teach your patients. This is a kind of a shortcut, basically because I'm a little bit lazy, I think, and I explain plantar fasciitis like for the bazillionth time, and it gets a little tiring. And the presentation helps me, but even then, you've been explaining this 50 times in the last month, and they're coming in, and you really want to do a better job. And so what I found is I took these same presentations and I recorded them into videos. And then I can add those to Patient Education Genius, and I can give them my videos on how to treat plantar fasciitis. And so they can watch it afterwards, because you're explaining it to your patient, but they don't understand what you're saying. They're overwhelmed. All they're thinking about is if they're going to get a shot today, and they don't remember anything. So if you can send them a video afterwards, that really works well. Another shortcut that's really worked for me is it's an ultrasound shortcut. We had ultrasounds in the office, and we weren't using it that much. And I found it really kind of complex to share with patients what they were looking at, because all they saw was like fuzzy lines. And I say, well, black and white are good, or gray is good, but black and white is not so good. And I tried that, but what I found really helped me is I made a presentation, basically just some PowerPoints and showing what a normal plantar fascia should look like, what a thickened fascia, what little tears look like, what's the normal thickness. And that's really helped for explaining ultrasound. And that's another one of the presentations that's working. So every time I'm doing an ultrasound, I'll say, hey, okay, Mrs. Jones, let's look at this ultrasound. And they can understand what they're seeing. And it just really kind of explains it. You can also show one foot to the other foot. That really works, but they still don't understand what they're looking on the ultrasound. Another shortcut that I wanted to talk quickly about is a shortcut for durable medical equipment. A few things have changed in doing DME. And the biggest shortcut we've learned recently is we had to have all this verbiage in our documentation, and they weren't getting covered because we didn't say you needed a SHOD device, non-SHOD device. And so we added a shortcut into our EMR, our medical record, of how we document it. And that's really, really simplified things for our practice. Like, these are the things we do. It pulls up the order, it pulls up this documentation, and it works really well for our practice. Another intellectual shortcut has been doing books. I take those same presentations, copy and paste them into like a Google Doc, and I kind of write out or dictate what I want. It makes a cool book. And then the last shortcut has been doing YouTube videos. That's been really helpful for the practice, getting a lot of views. And the patients that go there and look at those before, they're much more educated. And so putting things on your YouTube, it's not to earn money from the ads on YouTube. That's not what it's about. It's basically a place you can put information, and you can share this with a patient much, much easier. And so that works really well. So I hope that helps. But basically, these shortcuts, how to make them, and they're fixing a problem. So if you guys have any other thoughts, let me know. I'd love to hear them.